name is Nelson Hernandez, and I'm a respiratory care student here at Miami-Dade College. And I will be showing you how to do trach care. The objective of trach care is to maintain a patent airway and skin integrity, and to prevent infections and displacement of the trach tube. Indications are any patient with a trach tube needs trach care. Contraindications are any patient with unstable vitals. If the patient has hypoxemia, you might want to hold off on suctioning the patient. The hazards are any signs of respiratory distress, atelectasis, bleeding, desaturation, hypoventilation, hypoxemia, and tachycardia. Now before we begin, we're going to check the physician's order. Make sure the patient needs trach care. Mr. Jones needs trach care. Now I'm going to knock, enter the room, and introduce myself to the patient. I'm going to go and wash my hands for 15 seconds, and then I'm going to put on my gloves. I'm going to make sure that this is the correct patient by checking his ID and medical record number. Then I'm going to set the patient up in semi-Fowler position and then check his vitals, which consist of respiratory rate, heart rate, pulse ox, and the breath sounds. If I hear breath sounds, coarse crackling, I will suction my patient, oxygenating him before and after for at least 30 seconds. Now I'm going to set up. My setup consists of an extra trach tube just in case, my BVM with a mask, because you can still ventilate a patient even though he has a trach, and my trach care kit. When you open it, you will have your sterile field. The part you touch is the part that's going to go on the bottom. You want to keep everything sterile. Then you're going to dump all the contents onto your sterile field like this. This is your sterile water. You're going to dump it into this compartment. This is your hydrogen peroxide, which you're going to dump into these two compartments. You have a pre-cuff 4x4 gauze, multiple 4x4 gauzes, the tracheostomy tube tie, a suction catheter for suctioning, cotton swabs to get in crevices that you couldn't reach with the gauzes, a brush, and your sterile gloves. You could put these gloves on over your gloves, or you could take them off and then put them on. I will show you how to put sterile gloves on. Your hands are dirty. You don't want to touch the outsides of the gloves. So you're going to reach in and aim your thumb, and then the rest of your fingers. Then you're going to go in like this, and you're going to do your other hand, aiming your thumb first. You could touch the outside of the glove with your other glove because they're sterile. Now, I'm going to remove his old pre-cuff 4x4 gauze and his inner cannula. And I'm going to dip it into the hydrogen peroxide and then scrub it with the brush inside and out around the crevices. Dip it again into the other hydrogen peroxide. Then the sterile water. I'm going to top it, and then I'm going to set it up here to dry. I'm going to get a 4x4 gauze, dip it into the hydrogen peroxide, clean around, make sure you hold on to his flange so it doesn't come out, clean around it. Then I'm going to get another gauze, dip it into the sterile water, and just clean again. And we're going to get one more to dry, holding his flange. We're always going to keep a look out at the vitals and make sure he's stable. Now we're going to remove his old and dirty necktie. Holding onto the flange. And we're going to place new ones. We're going to replace back his inner cannula, lock it, and put a new pre-cut 4x4 gauze to keep everything dry. I'm now going to reassess his vitals, heart rate, respiratory rate, pulse ox, and breath sounds. I'm going to chart everything I did. I'm going to ensure the patient comfort. I'm going to take off my gloves, then wash my hands and exit the room after I've cleaned up. This has been a how-to video on how to do trach care. I'm Nelson Hernandez. Thank you for watching.